You wash your hands multiple times on a daily basis. You wash them before you eat, after you go to the bathroom, and after you come back from work. It seems like a no-brainer, right? However, the thought of washing your hands was not well known in the medical community until about 175 years ago. Dr. Ignaz Semmelweis was the doctor that got crushed for making the statement that doctors were putting their own patients at risk by not washing their hands before examining them. The medical community's response to Semmelweis's claims was to label him as insane. As a result of being labeled insane by the medical community, Semmelweis was institutionalized and died as a direct result of the disease that had caused him to become an advocate for better hygiene practices. In 1846, Vienna was home to the Vienna General Hospital, one of the most esteemed hospitals in all of Europe. Unfortunately, the hospital had a very dark secret. Mothers going to deliver their babies were dying. In fact, the Mothers Clinic at the Vienna General Hospital had a hospital-wide maternal mortality rate of 18% or more, meaning that 1 of every 5 mothers who delivered in that clinic would die as a direct result of complications caused during childbirth. The cause of maternal mortality at the Mothers Clinic was referred to as childbed fever. To show just how serious of a problem mothers believed the Mothers Clinic was, many mothers refused to go to that hospital, and some mothers would rather give Rose to deliver their babies than risk giving birth at that hospital. Many mothers have indicated that dying in a gutter while giving birth was a better option than dying in a hospital bed. It was interesting how, when comparing maternal deaths between both clinics, we learned that if a mother was in the second clinic, there was 98% less chance that she would die than if she was in the first clinic, 15% to 2%. Well, no one was able to provide an explanation for why this was happening. Doctors contributed all kinds of irrational reasons for the deaths in the first clinic, and only one doctor would not accept these ridiculous excuses. His name was Ignaz Semmelweis, now with a different name, Dr. Semmelweis. At 28 years old, Dr. Semmelweis would help change medicine forever. Why are mothers dying at such a high rate in the first clinic and not in the second clinic? This question consumed Dr. Semmelweis. He studied all possibilities, for example, diet, birth positions, proper ventilation, religious traditions, etc., but nothing explained the differences between the two clinics. Then tragedy provided the answer to his question. In 1847, Dr. Semmelweis's close friend, Jakob Kolechka, was accidentally cut by a scalpel when performing an autopsy. Shortly after being cut, Dr. Kolechka died of an infection that was identical to the childbed fever infection. For the first time, Dr. Semmelweis connected the dots. The doctors who worked in the first clinic regularly did autopsies every day to dead women and immediately went to the maternity ward of the hospital to deliver live babies without washing their hands. Therefore, they, the doctors, were transmitting death to the mothers they delivered babies to by touching a dead body first and then touching a woman, mother who was alive. In Dr. Semmelweis's opinion, the doctors were the ones responsible for the majority of maternal death, so he began to take steps to correct the problem. Hospitals were not performing autopsies on patients who died from the complications caused by childbirth. That was why women who received care from midwives at the second clinic survived. The first action Semmelweis took when he arrived at the first clinic was to instruct all of the physicians and staff to wash their hands thoroughly in a chlorinated solution before they had contact with any of the patients. He wanted to eliminate any residual odors from the deceased. The impact of Semmelweis' discovery was immediate and remarkable. In a matter of weeks, the overall death rate in the first clinic had decreased from 18% to 1.2%. Several hundred women who would have died during or after delivery were saved. Clearly, the medical community had a reason to celebrate. One of their own had solved a tremendous medical problem. The mortality rate of postpartum women had been reduced, and the statistics demonstrated it. Instead of receiving accolades for his work, however, Semmelweis was met with a great deal of resistance from the medical community. He infuriated the medical establishment by showing that the act of washing their hands was the reason for the reduction in the number of maternal deaths in his care, and that respected and educated physicians were responsible for causing the deaths of their patients. The physicians in Vienna were unable to accept that their egos had been damaged. The leading obstetricians in Vienna publicly condemned Semmelweis's theory and refused to wash their hands. The chief of the obstetrics division at the first clinic terminated Semmelweis's contract with the first clinic, and he was dismissed from his position for saving lives. Semmelweis returned to Budapest and secured a position at St. Rochus Hospital. He repeated his previous actions by placing great emphasis on handwashing, and once again childbed fever nearly completely disappeared. Semmelweis's masterwork, published in 1861, contained all of his findings and evidence and was sent to medical societies throughout Europe, which most of them ignored, and a number of them mocked Semmelweis. Out of frustration and desperation, Semmelweis wrote angry open letters to leading obstetricians throughout Europe that accused them of being irresponsible murderers. They were aggressive and harsh to read, but what he said was true. By 1865, the long years of rejection had left Semmelweis feeling incredibly defeated and having turbulent and unstable emotions. On July 30th of 1865, colleagues lured Semmelweis to a mental institution, leading him to believe he was merely viewing the facility. Instead, he was committed there as a patient. Realizing the deception once he was there, Semmelweis attempted to leave. Security guards restrained him and severely beat him. On the 13th of August, 1865, 14 days after being committed to a mental institution, Ignaz Semmelweis died. He was only 47 years old at the time of his death, but the way he died was by blood poisoning sepsis due to a gangrenous wound. Ironically, this tragic outcome took the life of the physician that provided the solution for preventing infections, and in doing so, was destroyed by the very medical establishment he was trying to reform. After 20 years later, the global health community finally caught up to the theories proposed by Dr. Semmelweis. Two major breakthroughs were made that would enable medicine to begin using hand washing as a preventive health measure. The theory of germs was confirmed by Louis Pasteur, and antiseptic surgical procedures were pioneered by Joseph Lister. Both men validated everything had been proposing 20 years prior. Hand washing is now universally recognized as being the single most important practice used in the field of medicine. Hand hygiene principles, which Semmelweis established in 1847, are followed in every hospital, clinic, and physician's office today. As the COVID-19 pandemic neared its end, hand washing became an essential practice of the global population. The world's population used the advice provided by Dr. Semmelweis 175 years earlier to help save countless lives. Today, Dr. Semmelweis is regarded as the savior of mothers. Dr. Semmelweis died in an asylum, isolated and alone, thinking that his contribution to the world had been forgotten. If you enjoy hearing about the unfortunate geniuses of the past brilliant minds that changed the world only to go unrecognized, then subscribe to receive additional content.